disrupting the rate of the transmission of this virus. This is the most important aspect because the issue of the economy becomes quite important. Whilst we balance livelihoods, we also have to make sure that we do save lives as a matter of priority. This is a national picture that we normally cover. These are the figures that are usually reported on by the National Department of Health, also collated by the NICD. It's important to note that the data, as it comes, it should reflect what has been captured at national level. And as a province, we don't really interfere that much in terms of the data. We just put our mind on how we interpret and how we're going to influence and change our decision and strategies going forward. But this just confirms that we have passed 2 million mark of the tests conducted in the country, and also that we as a country have moved closer to the top 5 of the countries who've got active cases and confirmed cases in the world. And this just makes us one of those countries that are highly affected at the current moment. And I think it's something that was expected actually even in Africa, pending that the majority and the part of the province is an urban province. We are quite also happy with the rate of the recovery, which is also holding true to most of the patterns that we've seen elsewhere in the world, that is above 50%. And also we are actually appreciating the number of deaths that have actually occurred, and would like to actually also from this point express our condolences to those who have lost their loved ones, who have lost their mothers, fathers, brothers, sisters, cousins, and relatives in this regard. This is a national picture which we normally demonstrate and also compare where Gauteng stands in terms of the pandemic and how things are panning out. And today we're also coming here also indicating that we are now an epicenter, both in terms of active cases and also in terms of confirmed cases. Gauteng has got almost 36% of confirmed cases and almost 46% of active cases. This is one thing that the position what we are actually taking over from Western Cape. The initial modeling that was done actually indicated that Gauteng was going to be the first one that will get to this number of confirmed and active cases, or become the first epicenter of the pandemic in South Africa. But I think the lockdown, level 5 and level 4, helped us in a great deal to reduce the rate. But now, because of our urban nature of the province, and also because of the highly populated province, 1 in 4 South African actually stays in Gauteng, and we've got a high number of informal settlements which are actually densely populated. So this number is actually expected, as we have said before, that being an epicenter of the pandemic is actually something that we were expecting, and we're just preparing for us to be able to deal with the storm. So as we said last week, that the storm is here, and now we have to play a part to weather the storm and make sure that we're able to deal with the storm as it goes. This is a nice graphical representation of the situation in Gauteng, which reflects on the positive cases, recoveries, and active cases, including mortality. One thing that is important to note is to see how the green curve is starting to show recovery, pardon the pun, but it's starting to go up towards the pink curve, which usually indicates to us that it means the majority of the people are starting to recover. And the number is actually coming up quite nicely, as we have indicated before. It has been a very great worry and anxious moment when our recoveries started to slow down. But because recoveries are a function of time in many respects, so we are expecting the recoveries in the next coming 2 to 3 weeks to even bypass the active cases. What also excites us with the pink curve is that it's starting to plateau a bit, and we are going to watch the progression of this curve. It's something that we are looking at it with glee and excitement to see that we are starting to almost stabilize. The actual increment of daily cases in Gauteng has almost been stayed in the average of around 4.8, 5,000 daily, and it's something that we are looking at and seeing the pattern. And it just means that we must put more effort in making sure that we stop the transmission, we reduce the rate of transmission, and we also disrupt the pattern of the spread of the virus. So we actually welcome the new regulations as announced by the President last week from the NCC and from the National Cabinet in terms of removing some of the few freedoms that our people were enjoying, and which comes with a level 3 lockdown in terms of alcohol, in terms of movement with the introduction of the curfew, and also just to reflect also on the interprovincial movement, which should be strongly and strictly applied. So we welcome those regulations. They will help us in a great deal to enforce and see how this second knuckle, they call it a knuckle, but for us in Gauteng, it's when we start to see that the numbers are starting to begin to slow down a bit, and it's something that we are happy with it and comfortable with it. I think the orange curve just indicates, and it holds true to the mortality rate that has been observed elsewhere in the world, in terms of the mortality rate remaining just less than 2%. And at the moment, as Gauteng, we are still within that thing. And it's something that we should try by all means to reduce the number of mortality. That's how we want to work with our clinicians in terms of improving the clinical outcomes, as it were. This slide just indicates and compares from last week, the slide that we showed you, the number of recoveries, and it just emphasizes the point about recoveries. You will see that there's a jump, a great jump in terms of the number of recoveries, and of a great worry, it's still the number of deaths that you are seeing. But you will also understand that there is a lot that can be explained about the deaths that we are seeing in the province, and working with clinicians, we are aiming to even go further in empowering our district regional hospitals to make sure that we're able to deal and reduce the mortality rate, or actually keep it in a very constant, steady rise. This slide also emphasizes a point of what I've said. You know, you'll see the levels of the lockdown and where we started to see a problem. Averagely, we have had the highest number of increased cases, which was on the 9th of July. Ever since, we have not had it, and we're just averaging here, like I've said, almost 4.5 to 5,000 cases daily. This slide just indicates our regional breakdown of positive cases. It's also important to note the recovery rate in Johannesburg vis-a-vis the active cases, which is one of the things that I'll keep on emphasizing now, because our point of the response plan that we have put up, and also our response as a country, was just to deal with saving lives and making sure that people do survive the disease as it is. And we're also happy that the recoveries throughout are coming in thick and fast, which is something that is quite impressive at this point. This is just also how we want to demonstrate the highest problems that we have as per sub-district. The sub-district that still gives us a problem still remains Johannesburg, but with Johannesburg, it's different sub-districts almost every 2 weeks. At some point, we were worried about sub-district F, but now it has been overtaken by sub-district D, which by and large has got a component of the mining community within it, and it's something that we are watching closely going forward. This is just only taking out the information from the last graph that we gave you. This is just the number of active cases, starting from the highest up to the lowest, and you will see what I've actually indicated in terms of the sub-districts in Johannesburg occupying the first three positions. This is the number of the recoveries, which is also a great demonstration of the previous graph. When we decipher the data, this is how it looks like when we're just looking at the recoveries in Gauteng. These are the daily increase in terms of the sub-districts. You'll see averagely that here we're looking at, when you look at the increases in the sub-districts, we're looking at around 1,000 throughout the province. This is a slide that we put up just to indicate the number of tests that we have done in the province, that we have actually contributed close to 500,412 tests that have been done. Actually, almost 1 million. We will be, I think, in the next coming week, we will have actually passed 1 million mark as the number of tests being done in the country. Gauteng will be having the highest as it is at the current rate. Still on the part of the testing, we want to also report that we emphasize the point of us changing our testing approach, where we're focusing on the most vulnerable, those who are actually symptomatic, who are seeking hospitalization, and our high-risk workers, particularly the healthcare workers, and also including police and also the soldiers and the educators in that space. So test approach has been changed, and we will have a national announcement on how we're going to be going forward in terms of de-isolating individuals who have tested actually positive, who might not be even required to do tests for the second time after they've completed their period of isolation. This is a scenario models that we have put up before, so we just continuously put up here for a quick reference on where when we expect the actual peak, and we will see now that we are closer. The one that holds true to what is happening currently, it is the South African model of which is done by SACEM, which is the one that tells us that the peak would be around mid-August towards early September. And it's something that we're working frantically to make sure that when we get there, there's nothing that will actually fall into the cracks. We'll be able to deal with the patient load. We'll also be able to deal with everything that comes our way. As we normally say, that weathering the storm is no longer about planning. It's all about now putting up interventions every day, every minute, every hour to make sure that we're able to respond to the challenge as brought about by the pandemic. This is just a demonstration of the current bed availability. We have been indicating this number. The number continuously increases every week as we put up the refurbished wards, as we open them up. We have done the same in Charlotte Maxeke. We have done the same at George Mokare. We have done the same in Kopanong, and we are going to continue doing the same in the coming months, in the coming weeks and days, to make sure that we're able to fill up the gap in terms of the bed analysis. The other important aspect about this, which I need to report on, is our bed management team, which combines us as a public sector, the Department of Health, with a lot of the majority of the hospital groups, where we're able to direct and also get us to be able to direct patients' flow and be able to see where beds are available. This is an important way on making sure that we calm down the panic and also calm down the desperation of beds. And when the EMS or anybody picks up a patient, should be knowing where the bed space is available, and they will be able to take up the patients there. We have also put up fever tents in most of our facilities, which will help us that the patients that are arriving in hospitals are not turned away. They actually get a place where they can receive treatment in the meantime whilst they are waiting for a formal bed, even if it's outside the public sector and also referred to a private sector. So the next slide will actually indicate the number of patients that we have in the hospital. As we speak, as of today, we have got 5,748 patients and almost 700 patients that are on in ICU, but 285 that are on a ventilator. So this is an important indication also about what we actually using for going forward, how we are going to look at the requirements for ventilation. But there is an indication that the new beds that we are putting up will actually be able to give this particular mode of treatment that is there. And with our field hospital in Nasrec, we are quite happy to indicate that the active hospital beds have started to admit patients. As of yesterday, we've almost had 50 patients in the space, and they are receiving the complete treatment, a step down from the hospitals like Holland Joseph and Chris Hari Baragwanath. This is just a demonstration of the number of and the gender distribution, age and the gender distribution of the deaths. Of important to note is also that we have started to see a number of young kids who are passing on, and this is a matter that our professor at Chris Hari Baragwanath will give us an assessment and an update on how and what could have been an underlying factor for those group of between 0 to 9. What was the underlying issue which contributed to them? This is just the analysis of the comorbidities that people who have passed on had. The majority of them still have got diabetes combined with hypertension, or hypertension alone and diabetes alone is still an indication that we are looking at. We'll remember that everyone is worried about our patients and people who are living with HIV, that we keep an eye on them. And this is a population of people that we need to keep an eye because of their immunocompromised state. But I think with the usage and the utilization of ARVs, it has actually impacted on a lower amount of it. But younger people are the ones that we see in this space of people who are passing on in this one. This is just we put it up there so that you see, we demonstrate to the public the number of days that are spent by one patient before they pass on, and you will see the majority of the patients are between first and 3 days, and this is where the problem is, and it's just an indication that most of our patients do come in a bit late to the hospital and seek medical attention. This is a slide that demonstrates our number of public servants in Gauteng who have tested positive. And we always make a point that the public servants in Gauteng, there are almost 172,000 in Gauteng. And out of that number, 3,246 have tested positive. And this includes our public healthcare workers and our educators. It's said also to announce to the Gauteng public that we have lost very dedicated public servants in our Department of Health. We have lost a cleaner at the EMS base in Tshwane. We have lost an EMS dispatcher. We have also lost a very young and energetic doctor at Pulosong and an educator to the pandemic. And would like at this point express again our condolences to the family, colleagues, friends of those who have passed on. And these are not just statistics. These are people who've got names. These are people who've got families. These are people who've got friends. And it's important to note whilst we are here that it is not about who. I think now we have got to a point as everyone else in the province that we know somebody or someone who has passed on or who has tested positive with COVID. So the reality is that we are now within the storm. We also want to indicate that the protocols of World Health Organization are followed after every case that we have actually discovered, and it continues. The protocols continues to evolve over time as the pandemic continues to grow, and this is how we would want to also maintain that consistency. This is just the light slides that indicates the amount of PPE that we have in the province. You'll see that the numbers continuously go up. We're still procuring and we are still receiving donations. We are still receiving a lot of stocks that we have procured. The issue that we are now dealing with more actively is the issue that relates to the equipment that will be required in terms of oxygen, concentrators, in terms of ventilators, and in terms of all the other equipment that is actually required. So it's an important aspect to it. Last time I did speak about PPB, which is a personal protective behavior that most of our healthcare workers and everyone else should be actually practicing, because most of the infections do happen not actually at the point of work where people work. The numbers that we've seen in some of the surveys have indicated that people who have gotten infected, they've actually got infected not during dealing with patients, but when they are interacting as colleagues. This is just two last slides that covers what we have done in terms of the social security and food security. We have long passed the 1.1 million mark, and we are now approaching the 2 million mark, which is something that is unprecedented, that as a province we have been able to do in terms of distribution of food, and we are going to continue to do the same. This is the number of the status of the shelters for homeless people. There's a lot that has been done in that regard, and also the provincial cabinet will announce soon the post-pandemic type of shelter, a homeless policy, how to deal with them going forward post the pandemic. As of now, I'm just going to hand over to the MSE of Education to continue on the issues relating to the reopening of schools. Then we'll have the closing remarks afterwards. Thank you. I'll go to sleep then.
Thank you so much, MSE Masuku, the Program Director, Thabo Masebe. Truly appreciate it. Let me echo the sentiments raised by MSE Masuku that on behalf of the Gauteng Provincial Government, we are indeed saddened and hurt on the passing of Comrade Zinzi Mandela. Hopefully, she's resting in power. We'll meet again. We also once more wish our Premier well and all other MECs in other provinces that have gone through this difficult period of this virus. We want to give an update of where we are in terms of education in the province, and we'll share various statistics with you so that you can have an idea on how our education system is functioning. Of the 2,131 schools that we have in the province, 1,977 schools were risk-free, which simply means of the 2,131 schools, 1,977 never had a COVID incident or reported any incident related to the virus. It's only 154 schools that we had to close and open because they reported incidents of COVID. And these schools, as I have indicated, were temporarily closed so that we can decontaminate the schools and reopen the schools again. And I want to re-emphasize those figures. Of the 2,131 public schools, 1,977 of those schools never reported any incident of COVID. It's only 154 schools that reported incident of COVID, and we had to close, decontaminate, and reopen those schools. In terms of special schools, these are learners with disabilities and learners with special challenges. We had, of the 129 schools that we had, 105 didn't have any incident of COVID. We only had 25 schools that had incident of COVID, and those schools were closed, decontaminated, and reopened. In terms of independent schools, these are schools that are subsidized by government, but they are mainly private schools. Of the 713 schools that we have in Gauteng, 656 didn't have any incident of COVID. We only had 57 schools of 713 that had incidents of COVID, and within that context, we have to close those schools, decontaminate them, and open them later. Since the reopening of schools to take the next round of grades, you will recall we started with grade 7 and grade 12. We brought grade R, grade 6, and grade 11. We've now consolidated the attendance registers of all these particular grades, and we want to share those statistics with you. You will see for grade R, that's where we've got the lowest form of attendance. Only 23% of learners came back. Majority of learners preferred to learn at home. We'll share the statistics of how many learners are studying from home so that we can see that it correlates with the figures that we have. In terms of grade 6, only 53% of learners came back. And in terms of grade 7, we are at 58% in terms of attendance. At grade 11, we are at 61%. The highest attendance is at grade 12 with 70%. It's still worrying. We can't account for almost 30% of grade 12 learners who are not attending schools in Gauteng as of now. It's something that we're working very hard to rectify because it has implication in terms of the skills base of the province, but most importantly, in terms of transition to higher education. We want to share with you the average attendance of educators in our schools. In terms of grade R, the attendance stands at 69%. In terms of grade 6, it stands at 71%. In terms of grade 7, it stands at 75%. In terms of grade 11, we are at 74%. And in terms of grade 12, we're at 76%. I think we are very fortunate that we've got 70% of learners that are attending grade 12. So the 76 attendance of educators slightly makes us to accommodate the number of learners that are available. So if more learners can come back, you will see that we are going to struggle in terms of teacher population. And we'll share with you the number of educators that have applied to work straight from home or not to come back to the education system forever. So we'll share that information with you so that you have an idea. We are sharing with you the number of COVID cases within the schooling environment. The number now in terms of the number of schools that are affected, as I've indicated, we now have 1,254 schools that indicated cases of COVID. These are in terms of the number of incidents within the school, not the number of schools, but the number of incidents within our schools. We are standing at 1,254, and of the 1,254, 402 learners tested or showed symptoms of the virus within the schooling premises, and 977 educators have symptoms of the virus, whereas within the admin staff, we've got 99 people, and general assistant staff, these are the people that are cleaning the classrooms, that are doing our gardening. We've got 44 people that tested positive. In terms of the youth brigades, the young people that are screening people when they arrive at our schools, the numbers have increased from 3 to 5. We've got 5 youth brigade members that tested positive. So in total, we've got 1,527 cases. As I've indicated earlier on, 154 of our schools have to close and reopen on the basis that they reported COVID cases. So these are the numbers that we have, and these are the numbers that we want to share with you. In terms of teachers that have applied and they want permission to work from home purely because they've got comorbidities in schools and in our offices, as of the 15th of July, those that are aged above 60, we've received 3,699 applications. Of the 3,699 applications, 2,117 are within the primary schools, whereas 1,193 are in secondary schools. And within the special education sector, we received 389 applications. So we've got 3,699 educators who are above the age of 60, and they still feel they've got underlying situation in terms of their health, and therefore they feel they can't report for duty. It's a huge number. It's a very huge number. So we're working on starting to then authorize those that can stay at home and those that can continue to work. You will see that the total number of concessions that we've received is 4,000 4,100. Of the 4,100, you've got 48 people that are working in our offices, and we've got 206 people that are working as teachers, but they're not at school-based, they're working at our offices. In terms of school-based, it's 3,414, and in terms of office staff that are assisting at school, we received 432 applications. So we are sitting with 4,100 applications of people that say they want to work from home or they want to be excused from work. Of the 4,100 applications that we've received, we've only approved 658. So you can see that we need to replace almost, if we have to replace educators in Gauteng that don't want to come back, we need to replace them. We need to replace 3,620 educators with young, dynamic, new educators. We've started that process. I'm excited with the number of young people that have lost their application, and we're encouraging young people to make those applications. We really believe it will strengthen the education sector as we move forward. In terms of scholar transport, we don't have any major problem. The scholar transport is moving well, and all our scholar transport system, they are fully compliant with the COVID-19 protocols. This includes our school nutrition program as well. All our learners are receiving their food at school without any major challenges. These are the risks that are emerging within the sector. The health sector's capacity to support schools is now overburdened. We are working together with the Department of Health to ensure that we can get additional support, and we are also investigating the likelihood of also bringing local government to provide an intervention and support where cases of COVID are reported within our schools. I've indicated that we've got a serious limitation in terms of those people that are applying for comorbidities. We need to process those applications as speedily as possible and also arrange substitute educators. Our target here is to bring young, dynamic teachers to the fold and ensure that we deploy them to our schools. There are various communities that have embarked in one form of protest or another, disrupting schools, closing schools. They are supported by various student formations and other parents' organizations. And in our province, we've put it very clear. You have a choice to stay at home or to come to school. And those that have taken a decision to come to school, protect their human right as well, that they've made that choice. And those parents that feel that children must not go to school, you've got the right to keep your child at home, and will provide academic support. So there's no need to disrupt schools on the basis that you want schools to be closed. But we've reported this matter to the National Minister. I know the National Minister is attending to this matter, and a public statement will be made by the Minister on how we are dealing with disruptions that we are seeing in our schooling environment. We are also receiving complaints about non-payment of stipends to our youth brigades. I can confirm now that the department has finalized all the necessary paperwork so that these young people who are committed and they've sacrificed their time are paid and they can get their stipends as soon as possible. We still have emerging incidents of vandalism, but we are attending to those incidents of vandalism. We want to bring to parents now that we've got 8 days left now in terms of our online admissions for grade 1 and grade 8. And we've received lots and lots of applications, and we're very grateful. Thus far, we've received almost 203,000 applications. Of the 203,000 applications, 95,000 are for grade 1, and 108,000 is for grade 8. We intend to conclude this process on the 25th of July, and we are urging parents to really make those applications. Those parents that cannot upload the documents, some of our schools have made arrangements just outside the school for you to go there and deposit your documents. To date, only 50% of the applications have managed to submit the required documents, and we're urging parents to do so as quickly as possible because this particular service will come to an end. I want to leave it here, and MSE Masuku, you can come and have your concluding remarks. Thank you so much.
Thank you very much. MSEs, there's some few questions that we received. I don't know if first in the House, if we can have any question more. You are fine? Okay, there is some question from Teta FM from Simon that recently the scientists reported that COVID-19 is airborne. What systems are you putting in place to make sure that the learners in schools will be safe? The second question is that teachers, police officials, healthcare workers, and government officials are testing positive almost daily for COVID-19. Is this a sign of a failure in the current system in place to prevent the spread of COVID-19, or a case of negligence from those who have been infected? What can we anticipate to see the Command Council implement in future if the situation gets worse in the province? Can we get an update on the condition of the Premier? Are the PPEs in schools effective? Then there's a question from Arisa Network 24. What is the provincial government's opinion on the closing of schools? There are allegations that much more COVID-19 deaths have been recorded than we know of. Is this true? When speaking to doctors from both the private and the public hospitals, it becomes clear that there is a serious lack of personnel. When we ask the Department of Gauteng Health, they say they are busy recruiting. How many doctors and nurses will be employed? By when? Another question from Arisa. How is the Premier is the same thing, or does it show any signs yet? The last question is from Sinesipo. The Tshwane Metro was supposed to have 20 COVID-19 testing centers to alleviate the testing burden from the health facilities by April, and yet they are still no show. The Metro cites that national government has not approved the size of COVID-19 test centers. As the provincial government, do we know why it has taken so long to approve these sites? We are approaching the peak. It's about the testing sites in Tshwane, that there were supposed to be about 20, and nothing yet that has actually been, nothing is functioning at the moment. The other part is that we are approaching the peak, and without these centers, the provincial government, is it not worried over the possibility of overwhelming of health facilities without the center in place? And lastly, when can we expect the approval of these centers? Tshwane has recorded quite a low number of COVID-19 cases compared to the province's other big cities like Johannesburg. Since the reopening of the economy, are enough tests conducted in the city? Another one from Claude from Business Day. Can MSE Masuku give an update on the progress on all the planned field hospitals? When are all the planned field hospitals are said to be ready? Can MSE Lusufi please indicate whether the matrics who are not in attendance at school are being homeschooled, or whether they are just not accounted for? How serious of a problem is this? Well, that's it. I'll then ask MSE Lusufi to come, and then Dr. Masuku, you can come and then also make your concluding remarks. Thank you very much.
Thank you so much, Vuyo. I'll respond to some of the questions, and MSE Masuku will assist me to respond to some of those questions that have been posed. In terms of the Premier, our Premier is in good spirit. Actually, is marshalling us behind the scene. We are working with him closely, and we don't think that there are some difficulties. He's relaxing, and he's keeping the entire executive updated on his situation almost on a daily basis. So we are quite convinced that he's fine, and he will be back to join us. That is in terms of the information that they shared with us. But if there's anything, the doctor is here he might be better positioned to respond to other things. In terms of the PPEs within the schooling environment, they are sufficient, they are enough. We had delays when other grades came on board, but now that everyone is on board, everything is fine. We don't have any major problems. Our position as government in terms of closure of schools, we really believe that the reopening of schools was expert-driven. It was not the department. Experts within the health sector and those that are knowledgeable about the virus are the ones that advise the department to bring learners back. And the decision to close or open schools lies with the president of the country in terms of the Disaster Act. The president only delegated that responsibility to the minister, the national minister. So our inputs, we will take them to the minister. And I know the minister has been consulting with us ever since there was this call by teacher unions to close schools. The minister has been convening meetings with MECs. We've given our side of our story to the minister. And I think at the appropriate moment, the minister will meet with the teacher unions and will find a way of dealing with these things. We are not hard as Gauteng whether schools should be closed or not. Those that are advising us, if they advise us to close schools, we'll close them. And those that are advising us, if they advise us to open schools, will duly comply. Because we are dealing with a virus that is not within the schooling premises, that is managed by experts who knows the virus and other things. But we want to caution, which is something that we really believe we need to be very careful of. We need to be careful of one thing, that those that have systems must not impose their will on those that don't have systems. Because if you say learners must live in an environment that is controlled, an environment where every morning when they arrive they are screened, every morning when they arrive they are sanitized, they learn something, they get their meal, they get transport to go home. If you say they must leave that organized system to go back home where there's no system, where they are playing football, they go to stores as they want, they play netball, there's no sanitization, there's no social distancing, they're not wearing masks, we need to be very careful. That let's take a decision that will be in the best interest of everyone, not in the best interest of those that have got access to sanitizers and masks. We must also think about those who don't have access to those facilities, especially the capability to social distance and also access to masks and access to sanitization. We strongly believe the schooling environment is more organized because learners can indeed be separated in terms of social distance, they are wearing their mask at all times, and they can sanitize. But if you say they must stay at home, if the environment at home is not organized, we really believe we have a situation, and that situation needs to be clarified. But as I said, we are relying on experts, and if experts at any moment believe that we need to take a decision to shut down school, we will be in a position to be influenced and accept that decision. We are worried with the number of matriculants that are at home. As we have indicated, in Gauteng, currently we've got 70% matriculants in our schools. 30% cannot be accounted for. And those that have applied to study at home, there are only 56. So you can see that the 30% that is not available and the 56 that have applied to use online registration, those numbers don't add up. We have a substantial number, almost 29%, of learners that are in matric, that are not at school, they've not registered online, and that's where we are worried. Where are they and what are they doing? And it's an element that we want to follow. The highest level of applications from parents that want their learners to learn from home is in grade R and grade 1. We've got the highest number of applications there compared to other grades. The lowest applications that we've received for a grade is grade 9. We only have 9 learners that have applied to study from home. These are the figures that we have within the department. But overall, as I've indicated, if you check the trends of infections that we're having in our schools, it's only 154 schools out of 2,000 134. Over 2,000 schools that we have in Gauteng, it's only 154 that have reported cases of COVID. So we really believe our schooling environment largely is safe for now, but we're indeed worried with the statistics that were shared by MSE Masuku, that for the very first time, between the category of 0 to 9 years, we've registered almost 8 deaths. So together with the Department of Health, we are now going into research whether those were learners within our schooling environment or within the private schooling environment, or if indeed they were students or learners. So that's one aspect that we are checking. We've also recorded an additional death between the ages of 10 and 19 for the first time. So we are also tracking that particular death so that we can also unpack it and understand what the cause. But generally, I think the statistics that the MEC have shared with us, it's quite clear that our schooling environment remains safe and is one environment that we just need to keep it that way. The only delay and the only major challenge is that when there is a reported case, we take time to clean up the school. And that's an area where the Department of Health and local government are going to assist us so that we can clean that aspect. Thank you so much. Thank you.
Thank you for the questions, and I think we will be able to respond to them. I think the first question about the virus being airborne, that issue had been in discussion for a very long time, I think since the beginning of February, March. And one of the things that the World Health Organization then advised us and advised the whole world to do is to also take some form of precautions that make sure that we are able to prevent any spread even when the virus suspends longer on air. It has been found in many experiments that, yes, in terms of the droplets and the sizes of the droplets, there are some in some conditions, particularly in air-conditioned spaces, you find that the droplets hang or suspend longer on air. And hence the issue that we are now advised that we need to do and advise everyone is to just increase general circulation of air within the spaces that we find ourselves in, maintain some form of social distancing, which also includes wearing a mask, because when you are having that type of disease process or the disease spread being airborne, those are the most important ways on how we can be able to prevent the spread and the transmission of it. So the World Health Organization has given us an advice, and there's a work group that has been formed which will finalize on a proper scientific advice that will come from the World Health Organization on the issues relating to airborne. But we have approached it in a way that suggests that even if we are having those conditions where the droplet suspends longer, we do have some form of mitigating interventions or methods that will use and prevent the spread, which is basically the most important one, increasing of ventilation and one form of social distancing, which includes the mask. And the issue relating to the other part of community acquired, you ask a question about schools being affected by infections, but we know as a matter of fact that most of the infections or of educators and learners didn't happen in schools. It actually happened in communities. And it is an expected pattern of the spread, because we are now in a space where widespread community acquired viral transmission is actually at a rise. So with the numbers that we are seeing in the communities, obviously, we will see the rise of people who work in many facilities, including companies, including healthcare facilities, that will also increase. We have made some form of a survey, particularly in Helen Joseph and in Kopanong and Tele, And we found that the majority of healthcare workers in particular did not, in actual fact, get infected in the workplace or particularly in the ward that they are working in. So there are very few healthcare workers who have acquired the infection who work in COVID wards. People who, and healthcare workers who had been infected, in essentially the majority of them are not working in COVID wards specifically. So there is an indication that community-acquired is more prevalent as we see it, and it's not about where people work, it's also about what people do when they are outside their workspaces or even outside where they are. But we are convinced that those who work in COVID wards, they do take necessary precautions and wear necessary PPE for them to prevent that. The problem, essentially, we did say that the virus does spread during movements of people. And yes, that's why we welcome the regulations as announced by the President in terms of the curfew, and also what the NCC is also considering in terms of weekend curfews where a reduction of movement would be considered. It's an important aspect of this nature. The other part about it is that we need to continuously observe regulations in terms of crowd control regulations, in terms of the number of people who gather and also how they gather and what other mitigating plans and that they put into place, like your sanitizing, your face cloth mask, and also social distancing. It is true, I think NERVEC 24, that the issue of the pressure, we have not denied it. Our systems, both private and public, they are feeling the pressure, they are feeling the strain. And it's just a meticulous way on how we have to manage our human resource, how to manage our beds, and how to manage the infection rate. And it is not really necessarily true that because of the pressure, then we are almost talking about the collapse of the healthcare system. It's important to note that we acknowledge the challenges, we acknowledge the pressure, we feel the strain. It's an added pressure in that regard, because usually during the winter season, we do have a period of time where we do have increased number of a number of admissions and a number of people seeking help, particularly in respiratory situation where they come in with the symptoms that are almost the same with what COVID is actually presenting. The issue is that we have divided our human resource plan into 3, and we are already covered the first phase, which actually saw us actually employing over 500 nurses and doctors, particularly in full-time positions. The second phase, which started when we began July, has seen us getting over 1,583 nurses, doctors, and all other categories. This also includes what we have welcomed this week from additional help from the National Department of Health, with nurses that were brought on and divided into all our clusters, which are almost 628. So the plan of increasing the number of staff is actually in motion. And like I've said to you, we are now dealing with the situation as it comes and responding to it timeously and in real time to make sure that we don't get to a point where we have a bigger problem. The third phase will be underway towards the peak. That is just towards the beginning of August, towards the peak. And this plan will also see us getting more doctors, over 500 more doctors and nurses and other categories of employment of healthcare workers. And these are phases that we have, and we call them lines of defense, because that's how we expect things actually to happen. The database that we have used, it's a database that comes from our e-recruiting process. It's a database that we have used from nursing agencies that are out there. It's also the database that we are using from the associations that health professionals belong to, like your SAMA, your SMDP, and your the National Private Health Practitioners Association, which is there. We also welcome the additional workforce that is brought in by the South African National Defence Force, which will actually help us with a lot of hands on deck, doing other general work in our system, in terms of driving, in terms of pottering, cleaning, and all sort of range of tasks that are actually done in health facilities. So there is something that is happening, and we are continuously, like we've said, we're in the storm, we're no longer planning. It means we have to respond on our toes and stay on our toes and make sure that we're able to respond on real time and lifetime in terms of what is happening in terms of pressure. The issue of the death, yes, there's no the allegation of death of that we're hiding death or we're not recording them. It's something that is a known scientific issue. The MRC reported this week that there are deaths that normally go undocumented in terms of the cause of death. But in the sense of COVID, most of the deaths do happen in our healthcare facilities, and where there is a delay in terms of results, and it also delays in terms of us announcing those deaths or including them in the statistics, is because we are doing that verification. The issue of doing swabs on patients that are suspected to be COVID and who maybe died at home or even died before they arrive at the facility, the swabs are done and we wait for the results before we include into the statistics. And hence, it's an important fact that we need to continuously clean and make sure that we're able to capture the number of deaths as they occur. And I think this one of swabbing or doing tests on people who just passed on, it's one other experience that we have learned from the Western Cape, which helps us to accurately capture the number of deaths that are there. So at no point we have the mandate to hide deaths, and I don't think it will be in a great public interest as a government to actually hide deaths. The deaths should be reported and they should be captured as they are and accurately as they are. And in relation to this, they do say when it walks and looks and sounds like a duck, it should be a duck, but we should have to confirm it first that it is a COVID death, and we shouldn't presume that it's COVID death. And we are quite smited by our own numbers that the mortality rate in the country and in Gauteng specifically still lies true and still holds true to the statistics that we see internationally in terms of the general mortality. The issue of testing sites, it's a matter that relates to the change of approach. It's not about us not accrediting, giving accreditation to testing sites. The change of approach is also influenced by the shortage of the test kits that are available in the country, even everywhere. So the test kits are actually put and reserved for patients who require hospitalization, who comes to our facilities with symptoms, and it also for people who've got high risk occupation like healthcare workers, educators, police, and soldiers. So that has actually prompted us to change the testing approach. So it's no longer a point of us doing massive community testing. It's only about those who are symptomatic and who require hospitalization. It's an important aspect that the National Department of Health is going to report on the basis of what we call de-isolation regulations. Whether we require somebody to do an added test after completing a period of isolation or not. And it's something that we are considering, and looking at the shortages, it might not happen that we will require that, because science does tell us that 14 days is actually the bare minimum that somebody needs for isolation and for the body to be able to mount a particular antibody immune system response to neutralize the virus. The system won't be overwhelmed because we still have the statistics that we are seeing that the 85 to 90% of the people who are infected of active cases generally do not require much medical attention. They are not found in our facilities. They actually found in many isolation areas or self-isolation areas. And this is what we are seeing, and that's what we are looking at. Particularly in Gauteng, the number still holds true, that there will be a lot of asymptomatic and mildly symptomatic individuals who are out there who don't require hospitalization. At the current moment, looking at the active cases of over 60,000 and only that 5,000 is in our facilities, is just a bad testimony that the system, with its pressures, with its challenges, it will be able to maintain itself and moving forward. And of course, as we prepare, Claude, towards the peak, which we do indicate that it will be a month from now, middle of August. And the NASREC has already started upgrading its phase 2 in terms of hospital phase, and already it has admitted patients this week where even oxygen is actually given. And we have already worked with the clinical advisory committee that works in NASREC to deal with more and getting more healthcare workers in that space, and that number is increasing. We are expecting by the first week of August that NASREC will be having 1,000 beds, and at least half of them will be able to give oxygen and IV actually treatment. Coupled to that, Tshwane Expo will also be ready by the first week of August. Plans and everything have been done. So now is the issue of putting it in place. And with the pace that we have seen with NASREC, we are clearly that by the first week of August, when we get to the peak, Tshwane Expo will also be available. And the SNDF assistance, it is still a matter that the Minister of Defence and the Minister of Health will be able to engage with and also announce in due course. Because any assistance that comes from the South African National Defence Force, particularly in terms of infrastructure, will have to be actually an order of the Minister and the decision of the Military Council, which we are awaiting in that regard. But maybe just to add and give you comfort, Claude, is that the fever tents will help us in a great deal in helping us not to have patients who will be managed on benches or patients who will be turned away from our hospitals. But this, we shouldn't say to everyone that we are not feeling the pressure. We are feeling the pressure, but it's an important aspect of us dealing with the peak and with an important aspect for us to be dealing with the pandemic as at this stage in Gauteng. And maybe in that space, I will go on to maybe conclude on this press media brief. That, like we did say, that the numbers of the new infection continue to rise rapidly. We want to assure the people of Gauteng that together we are weathering the storm. Together we should be able to roll with the punches to make sure that we are able to respond in real time to all the challenges that are faced by our facilities. And this just requires all of us to play a role. As private citizens, it means we must be able to do and take a lot of work in terms of social distancing, in terms of wearing face cloth masks as when we go to the public, and also avoiding crowded places. It's an important aspect that we might need to encourage our community to do, to make sure that they stay at home and reduce the movement, which will help us to reduce the rate of transmission. We are continuously saying to you that we are strengthening the healthcare response by taking all necessary measures that we are implementing currently. As I've said to you, that we are not now planning for anything, we are now just implementing all what we have been discussing and also implementing intervention method as we see the pandemic evolving. And this is just something that needs a dynamic leadership that will be able to review and use data and make necessary correct decisions. We continue to work with the private sector effectively to make sure that the bed capacity in our province is adequate. There are a number of efforts that we've put into place. Like I've indicated, the bed management team is doing that and it's helping us. So the dashboards are actually live. We will share with you the dashboards live of the private sector and also the public sector in terms of the beds capacity and where the beds are available in the province. Whilst we see that there are admissions that are actually rising, but we also accept that the bulk of the people do recover, particularly those who have been admitted and those who don't require much of admission. Our recovery rate is still going to come up. We are closer to 50% now, but we are quite confident that our recovery rate will reach a proper figure of over 60%. And we also say that we need to take care of those part of our population who are over the age of 60 and above, and those who are living with existing conditions, to take necessary precautions and make sure that when they feel unwell, they must seek help adequately and quickly. We like to also continue to say to you that the human resource capacity will continuously be going up, and we also continue to acknowledge the additional staff and additional help that we are getting from the South African National Defence Force, which we truly welcome. This, as Gauteng, we just also want to say we welcome the measures announced by the President, the State President, the Commander-in-Chief of the Forces of the Republic of South Africa, who announced how we're going to strengthen the compliance with the lockdown regulation. And we are happy that the President responded positively to most of, if not all of the issues that we raised as Gauteng to the National Command Council. We urge the people to adhere to the curfew as announced by the President and avoid gatherings such as parties and after tears, particularly after funerals, to limit people who are attending to the funerals to a number that is less than 50%. And we also encourage people to wear masks when they are outside there in the public, and also practice physical social distancing. The spread of the pandemic continues to raise fears and anxiety in the community as a result of limited knowledge, but it's important that people who are affected by COVID-19 deserves our support, deserves our compassion and kindness in their journey towards recovery. We continue to observe, encourage our families to observe and avoid visiting friends and family, because that's where we tend to lose our protective instinct when we're with family and friends, and that's where maybe the part of the disease starts to actually to spread. Tomorrow we'll be commemorating Nelson Mandela Day, and this is where all of us as South Africans, we need to play a role and spend 67 minutes in actual fact servicing our people and sacrificing it from our time. But in this place, we want to say that let's try to do and be creative when we embrace the Mandela Day or when we celebrate the Mandela Day, but just keeping closer and making sure that people are determined to overcome the virus and people are able to uphold the regulations that will make us stop the spread and stop the pattern of the spread. So it's important that when we do the Mandela Day creatively tomorrow, we must still continue to adhere all these aspects of our strategy for us to play our part and stop the spread. And also maybe just to also take this moment to pass our condolences to the Gauteng Provincial Legislature, who lost one of their committee chairs, Honorable Member Mapiti Matsena, who lost his life yesterday. And we want to also express our condolences in that regard, and we just wish him to rest in power. But let's play our part, let's play our role to make sure that we reduce the spread and keep COVID away from us. Thank you.